as well as in a distance mode. We have 4.
Welcome to the session on guidance and counseling for nursing students. I think all of you, some point of time, must have taken guidance from someone for your personal issues. Maybe when you were student, for your career, after you completed your GNM. And counseling, maybe for the issues, sometimes problems we are not able to solve. And you must be in the hospital approached by certain nurses to get guidance and counseling from you. And especially the students, when they come to College of Nursing or School of Nursing, they come to a new environment, which is very different from normal college of doing BA or BSc. They come to a professional college or School of Nursing, where they find the studies, the scenarios, time schedules are very different, and they have to see that in the semester they are able to complete all the subjects, they are able to go for the duties, and sometimes they have health issues, personal issues, social issues, economic issues, and they need some guidance and counseling. So in this session, let us go through some of the aspects related to guidance and counseling. Guidance and counseling is required by any student for the support of their career development and personal growth. After doing 10+2, you must have seen many students, they are interested to do medical, dental or paramedical courses or nursing courses, or to go to a general stream of the courses. But they do not know whom to approach. They may ask some guidance from their parents or from their maybe some family member, friends. So that is a guidance related to career, what they have to do in the future. That's very important. Once they go to that institution, they need guidance related to teaching and learning. That already I have told you, when they come to nursing college, they need different type of guidance, orientation by the teachers, that what type of this course is, why they need to take care of their health because they have to work with the patients, why they have to emotionally strong because they will be seeing sick people in the hospital. They will be seeing variety of the people, maybe the older age, maybe the children, maybe they will be posted in the operation theater where they will see that different type of procedures are being carried out. So they will be needing guidance and counseling for the teaching and the learning activities. They have to submit the assignments in time, but maybe they are not able to manage the time. So these are some of the areas where actually your students need guidance and counseling. So what is guidance? Let us see the word guidance meaning. Guidance means seeking help by an individual for some information about himself, about some course, about their own abilities, and maybe they want that information for their future development. What they will do if they do this course, what are the future careers in the particular field. And let us first see what guidance is not. That means guidance is not compulsion. That means it is not required by everyone. If needed, one can go for the guidance. It's not compulsory that every student will go for the guidance, because somewhere the family also guide the students, and nowadays they take the guidance of some professional organizations also. It is not making decision for others. That means if you are guiding someone, you are not making decisions, you are giving information. You are telling them these are the options available, these are the career prospects. After completing that, you can do this, this, this. You are guiding them from where they can get the prospects, what are the websites available, which are the colleges available, giving them the information. It is not advice. It is only giving them the information. It is not pampering the student. Some people think if you are guiding too much a student, you are pampering. No, you are helping them to gather the information so that they can take a right decision. It is not adjustment, and it is not a problem solving. What is guidance then? Guidance is a process. It is a continuous process. It is concerned with some issue or a problem and choices. It is an assistance to the individual in the process of development. You are giving them the information. You are helping them to make choices. Okay? It is generalized and specialized, and it is available for everyone whosoever need it. Nature of guidance, already I have told you, it is a process. Aims to assist in the development of the individual, keeping in view their personal and social needs. It is a continuous process. Maybe in the school, when the student is there, they need guidance of different kind. When they complete the school, they have to choose for the college what type of course they should do. They should do any professional college program. If they are not able to compete, suppose they want to do NEET exam they want to give, suppose they are not able to pass out the NEET, what are the other options? So then when they complete their college, they have to opt for the job, what type of hospital they should choose. They should work in India or they should go abroad. If they do further studies, what are the prospects? It goes on continuous process. And even if they get married, they will have their own issues for starting a new life. If they had problems, go to the hospital, they may have certain issues and need the guidance. They have to understand themselves. They have to understand the situation where they are working. They have to understand their own capabilities, their own interest, and they have to continue development. Personal growth and development continues. They continue with their struggles, but they learn from their experiences, and if they get correct information, they are able to adjust with their new environment and able to solve their problems. That is the basic aim of guiding the students or guiding their staff. It is related to your life and the growth and development. A person get informal guidance from their family, friends, relatives, and sometimes if the issues are grave, they may go to maybe a professional guidance also. Then development of capabilities. Maybe there are some students, when they join nursing college, they are not able to cope up with the stress of the studies. Maybe they are not able to cope up individual studies, because when you stay in the hostel, most of the time students prefer to study alone. They may not study in a group, but this particular student is not used to study alone. So maybe in the beginning they need some guidance, how to study, how to manage the time, whom they can go and take help, if they want any library books or any teacher can help them. And sometimes the hidden potential with the guidance they are able to see they had that potential, but maybe with the guidance they are able to assess their own potential and the capabilities. They emphasize the guidance emphasize on the complete development of a person and help them to have a self-realization. Individual assistance, there can be individual problems, and those problems can be help them to get the information so that they are able to solve their issues. It helps them for the adjustment, already I have told you. It helps in preparing for the future. Suppose they get the right information. What type of career they have to adopt? What type of prospects are available? They can make their right decisions for their future. Who and when needs the guidance? It can be any individual. Any stage of life, we can need the guidance of someone. Sometimes small issues are there, but we take so much of stress that we are not able to think rationally. Solutions are there in front of us, but if someone gives me little hint, little information, I am able to solve my problem. So, same way, able to adjust with the environment. As a student, when we go to a college, teachers are there to help us. We have our peer group, but suddenly, after completing 4 years, I go and join a hospital. There now, as a staff, I have the responsibility. But again, if someone is there to guide me, to help me, give me the information, how I have to work in a new environment, what are the rules and regulations, just give me the information, guide in doing certain procedures, then the adjustment becomes little easy. Less burnout and stress is there. Information is required to solve the problems. Self-development, already I have told you, that is very important. More you learn, more you understand, then a person is able to realize their own potential. Where all the student or a staff need guidance is your educational guidance, vocational guidance, personal guidance, economic guidance and health guidance. Sometimes student is not able to handle their finances or do not have that much of finance to continue their study. If they get the information from where they can get a loan, nowadays banks are giving loans, for the study loans are there. What are the options available? Student can go there, and sometimes there are alumni funds are there from where the student can get some help, so that help them to complete their studies. Health guidance, sometimes students have health issues. If they get information in time from where they can, whom they can approach for their treatment, what are the facilities available for the students, they have a health card, who is the health teacher who is taking care of their health, or in the hospital, what is the committee which is there who takes care of the health of a newly appointed staff, or if a student nurse is there in emergency, whom they can approach. All these information help them to take care of their health and the various small issues. What is counseling? We are not professional counselors and nurses, but we counsel the patient, we counsel our students on various issues. It is a process which an individual learns to be independent, to make decisions, to live with the problem situations and to face the crisis, to help the student to solve their personal, educational, social and other problems. Counseling is an interactive process which facilitates meaningful understanding of the self, of their environment, of their situation, and take appropriate decision by the person who is having the problem. What is the purpose of counseling? The main purpose is, generally people come to counseling clinic if they are experiencing some form of stress in their life which causes discomfort, anxiety and other issues. And purpose of counseling is to explore these issues if it is important to the client or to the student. There can be individual counseling sessions with various issues, personal, social, economical, psychosocial, your adjustment issues, or it can be family counseling where not only the student but if the family members are also invited. It can be a counseling in the school or college of nursing where student also comes with the teacher if there are certain issues with specific teacher. But then what are the two types of counseling? You should understand the difference. Directive counseling, that is, counselor have major responsibility of solving the problem. Counselor identifies the problem, defines it, diagnose and provide a solution to the counselee, that is your student. Counselor directs thinking by informing, explaining, interpreting and advising, and it is counselor oriented and it is emphasized on the problem. That means here counselor has a main role. As a teacher, you are a counselor. You are identifying your student's problem. You will see what are the causes of the problem, what are the underlying factors, what are the solutions available, and what is the best solution for your student. Then you will give option to the student. You opt from this solution and discuss the how to implement that solution. So that is directive counseling. Role of a counselor, the steps are analyzing, synthesizing, diagnosing, prognosing, and then doing a follow-up. Already I have told you the steps. These are the technical words which are being used. You are analyzing the situation, synthesizing, diagnosing what is the issues. Then you are implementing the solution, seeing the prognosis. Then you are evaluating it. Then you are taking feedback and doing the follow-up. Second method is non-directive. It is your student or counselee oriented. That means counselee is allowed to assess their situation. Counselee or your student diagnose the issues. You support them. They are able to identify what are my resources to solve this issue. What are the baseline factors that is causing these issues? What solution I can implement it? And what is the best solution within my limited resources? Then they try to, student himself or herself try to solve the problem. Then evaluate it. How much problem I am able to solve it? Then they take the future action. Here your student or a counselee take the main decisions, analyze it, synthesize it, implement it, evaluate it, they analyze even at the end the feedback, then again see the situation. So these are the two basic methods. One is elective counseling, that is combination of these two, directive and non-directive. According to the situation, sometimes counselor take over the role and sometimes the counselee take over the role and the try to solve the problem. The steps, again, it is initiate the interview, develop rapport with the counselee, tentative time is set, privacy and confidentiality is maintained, then diagnose the problem, formulate action plan, gather the information, resources, implement, follow up, do the evaluation, then do the feedback and try to resolve the solutions, problems and modify the situations. Features of counseling, very important is it has to be based on certain problem of the counselee. They feel it is important for me to solve as a student or as a staff. And the purpose is to see that, able to analyze the situation, find out the solution and solve the problem. and make the counselee or the student independent, so that in future they are able to handle their problem independently rather than coming for small issue to the teacher or the counselor. It is a process. Already I have told you there are the steps which goes on till the time the problem is solved. If the next problem is there, again the same steps are being followed. And the counselor, it's very important, should be a good listener, should be empathetic, should have information, should clarify the situation, should understand and analyze the situation and the resources, and should be non-judgmental towards their student or the counselee. Value the student that he or she is an individual and have this issue, and it is my duty to counsel or help the student. That is a very important thing a teacher or a counselor has to keep in mind. So what is the counseling process? Let us see that. It consists of basic 4 steps. Identify the need for counseling. Is there really a need for counseling, or only guidance is enough? Prepare for the counseling, the room, the individual and the situation. Conduct the counseling in a proper way, with the privacy, with the non-judgmental attitude, with the good listening skills and the observation skills. Then follow up and give the feedback. And most important step which has to be kept in mind, establishing rapport first with the student or with the staff whom you are counseling. If you have a good rapport, if the trustworthy rapport is built up between the counselor and the counselee, then only your counseling will be effective. Otherwise, your student or the counselee will have a doubt. Shall I discuss my problem with my teacher or with my senior? Will they keep it as a confidential? Will they be non-judgmental? They will not discuss my issue with others. They should have that much of confidence. And this relationship is unique. Remember that if you are able to maintain this trust, good rapport, your counselee or student will actually come out with their issues. What are their family problems, personal problems, adjustment problems, social problems, economic problems? Why these are happening? Even sometimes they have crisis due to adolescence age, because they come out from home stay in the hostel in the stressful situation, and they have to go to the hospital and adjust to that situation. So then only they will come out with their issues. So how to establish a relationship? First of all, introduce yourself. Be polite. Have eye-to-eye contact. Have a smile on your face. Welcome the student. Listen attentively and remember the name of the student so that they feel you are being accepted as an individual. Always address individual by his or her name. Ensure the physical comfort, mental comfort, privacy is maintained. Do not interrupt the individual when he or she is speaking. Even if you have any questions, queries, keep for the end. Be a good listener. Actually listening mentally, not just physically sitting there and thinking something else. Observe non-verbal communication, expressions, body language of the student. Don't be non-judgmental. Maintain privacy and confidentiality. These are some of the important points you have to keep in mind if you want to have a good interpersonal relationship. So in this session, we have learned about what is guidance, what is counseling. Guidance is for any issues, getting information, for personal growth, for making decisions about their career, what course to use, what vocation to use, if they have any financial problem, where to go, how to get loans, if any health issues, what are the various options available for diagnosis and the treatment. And counseling is some problem which is bothering you and not able to help you to adjust in day-to-day life, and you need a professional help later on first from your teacher, maybe later on if required by a professional counselor. And there are directive counseling and the non-directive counseling and the elective counseling, where the role of a counselee is defined, who will take lead and what are the steps of counseling. And most important is establishing good interpersonal relationship with your student, trustworthy relationship, so that they can trust you and come out with your problems. In this way, this will help the student to adjust in a situation, because they come out after 10+2 in school and college of nursing in a situation, a teaching institution which is different from a normal college. They have to time constraint is there, they are away from their family, they have to go to the hospital, see the sick patients, deal with them, they are being posted in operation theatre, labor room, sometimes in a burn department, and they are not able to adjust. And there are some students who really face financial problems, health issues. If their health is not in a good state, they may catch some disease or some infection. So those things has to be taken care of by the teacher or by a senior staff. As a nurse administrator, you have to guide them what they can do, where they can go, provide them the information. Today's student is very smart. If you give them a proper situation, they can take a decision for their growth and development, and they can progress in future. Thank you.